Alright class, I'm going to go over and do a review with you for our test for this Thursday. We're going into week 3, starting off on chapter 36 on moisture control. So there's 2 different type of evacuating systems that we're going to use in the dental field, which of course are going to be our saliva ejector and our HVE, right? We always make sure with the HVE that this is pointed upwards whenever it's positioned, okay? And these are going to be mostly used throughout a restorative dental procedure, okay? Your high volume evacuator, it is able to take up water and debris because of its high volume of air that is moved into the vacuum hose at low pressures to create a strong suction. So this is going to be, of course, your stronger suction when he's in there doing his procedures. This is the one that you're going to be using. You're going to have it positioned just parallel to where he is working on. So, and we'll go over the different positioning on that. And then we're going to do them, you know, most of them are going to be disposable, but they do have some that are able to be autoclaved too. But the majority of the ones that you're going to use out there are going to be your disposable, which means you're going to get rid of it after we're done with this procedure. There's 2 different ways to grasp the HVE. So the HVE can be the thumb to nose grab, so like this, which you would use that mostly like if you're using your HVE to retract. Most of the time you're going to hold it with the pen grip, okay, just like you would a pen, to have it positioned behind where Doc is going to be working at, okay. And we've been practicing those as you guys have been coming in, those that have come in to work on checkoffs as we're doing four-handed when I've had you position the HVE and saliva ejectors, stuff like that in the mouth. So, and we'll continue to go over those as you guys continue to come in. So placement of the evacuator, again, we're going to place it before the dentist positions his handpiece and his mouth mirror. So we're going to make sure that we are in position before he gets in there and starts working, okay? And then we're going to position the suction tip on the surface of the operating tooth closest to you, okay? And make sure that the bevel, which is this part, will be the bevel of the suction tip, is going to be parallel, okay? And keep the edge of the suction tip even and slightly beyond the occlusal surface and or the incisal edge, okay? Daily maintenance of the evacuation system, we're going to make sure that we're always flushing our hoses out with like an antimicrobial solution. You're going to follow your infection control policies when handling contaminated items. And we're going to check disposable traps weekly and replace as needed, which they'll go over that in the dental office and show you how to do that. And it'll also be written down that you've done your weekly maintenance. You'll have a log in there that you're going to be doing, just like as well as with the autoclave, okay? That'll be somebody's responsibility to keep up with. And then open the saliva ejector hoses and clean and make sure that they get replaced if they're needed to get replaced. Isolation of teeth. This is ideal for conditions during dental procedures. The isolation technique is going to should be easy to apply. It's going to protect the soft and hard tissue. It's going to be comfortable for the patient, or should be comfortable for the patient. And it provides retraction for better visualization for the dentist when he's in there working. And it prevents the moisture contamination, and it isolates that area that they're trying to work on. So the area of concern is going to be isolated. So there's 3 common isolation methods that we're going to use, which we have practiced as you've come in and worked on four-handed. Of course, with our mannequin, it's a little hard to get the dry angle to stay in there, and also the cotton roll, but I know that we've practiced positioning on those. So cotton rolls, dry angles, and then of course the dental dam. Most of us that have came in have practiced the dental dam too. And it's going to depend on your dentist in the office that you're working at, what type of isolation methods that they are going to use, okay? The dental dam is going to be placed after the local anesthetic has been administered, okay? And then remember on there, the ligature, that was the piece of dental floss that was attached to the dental dam clamp, okay? And then the dental dam clamp, this is going to be the jaw part of it, is the part of the dental dam that is that went around the tooth that we clamped onto the tooth. So it encircles the tooth, and it be firmly seated for to keep that clamp stable. Okay. In chapter 46, we talk about impression materials. Some of us that have been in have done impressions. We've poured up study models, and we've also practiced trimming those models. So if you have not been able to come in, I know some of y'all have made arrangements with me to come in at later times. I know everybody's situation is different, so we will get you in and make sure that we get practice on all of these when you get to come in. But there's a lot of stuff to cover, and the more that we practice it, the better you're going to be, and the more comfortable you're going to be whenever you get out there in the field. Okay. And I just want you to be as comfortable and as knowledgeable as you can whenever you go out. Okay. So we have different types of impressions that we're going to do. So you got preliminary impressions. These are going to be for your diagnostic models, or for orthodontic appliances, or for provisional coverages. Okay. Final impressions are going to be taken by the dentist. Okay. These are the ones that are going to provide the most accurate replication of the teeth and the surrounding tissues. And legally, the dentist is the only one who is supposed to take that final impression. Okay. Then you have your bite registration, which we'll practice these as well. Of course, we'll have to use our models to do it. Or if we can get some volunteers and somebody wants to let them practice on them, we can do that too. Shows a replication of the occlusal relationship of the maxillary and the mandibular teeth. So this is where they're going to bite down on. Okay, that occlusal surface. So there's different types of impression trays out there. You have your quadrant trays. These are the ones that we were using whenever we were practicing on our temporary crown. Okay. Then you have, of course, stock trays, you have section trays, and then we have our full arch trays that we were using to do our impressions. Your custom trays, these are going to be constructed out of resin, and these are going to be made to fit a patient's specific mouth. So they're not going to be used on just anybody. They're made just for that patient. Okay. And then you have your irreversible hydrocolloid, which is your alginate. Okay, so whenever we were in and we were practicing with the alginate, we know, probably not because we didn't try it on each other, but you guys have had impressions done before, I'm sure. It's flavored, and it is going to change colors when it gets ready to set. So we know it went from that bright purple to a bright pink to a lighter pink to a white, and it can set up pretty quickly on you. So we need to make sure that we're getting in there and mixing that alginate and getting all the powder incorporated, getting all the bubbles out, getting it loaded in that tray and into the patient's mouth in an accurate time before it sets up on us. The alginate impression should be poured up within 1 hour. And if we soak the alginate in water, it's going to cause imbibition. So this just means it's going to take up the water. So after we did our impressions, remember, we spray it with a disinfectant. We get a damp paper towel, not soaking wet, but a damp one, and we're going to wrap it around our impression until we get ready to pour it up. Okay? And then the alginate does come in different types of how fast it works, so it can be available in regular or a fast setup. Okay, and when we're taking impressions, the mandibular impressions are going to be taken in the operator position, which means you're going to be in front of the patient when you do it. The maxillary impressions are going to be taken behind the patient. Okay. You remove from the mouth in one quick snap, out motion. I know with our mannequins it was a little bit harder to do that, but once we get to where we're practicing on each other, it will make more sense and it'll be easier. Of course, the mannequin doesn't produce any saliva, so it makes it harder and it tries to stick onto the mannequin's teeth whenever we were doing it. The elastometric material, this is going to be used when an extremely accurate final impression is required. Chapter 47 goes over laboratory materials and procedures. So whenever we're pouring up the impressions, this is done 45 to 60 minutes before trying to remove the model from the alginate impression. Of course, we have to pour it up. Remember, we took our impression, we took it into the lab, we mixed our stone, which is going to be the consistency of like a creamy peanut butter. We poured it up, put it on our slab, put our impression on it, and we had to let it sit there for a while because most of us went and we did a temporary crown during that time, or went on to do some four-handed dentistry and then went back once the model was set up. So it takes 45 to 60 minutes for it to set up, depending, of course, air, humidity, everything is going to make a difference with that, how fast it's going to set up. And then we're going to go in and we trimmed it down. So whenever we were adding the stone in, remember we did, if you do it in too small of increments, it's going to cause bubbles. Of course, we put it on the vibrator to help work down those bubbles whenever we had our stone in our bowl. And then before we poured it into our impression, remember we put it on the vibrator to work those bubbles out, okay? And it can also be caused from improper pouring of the impression, where you get too much bubbles in there. So just make sure that you know adding the stone in small increments can cause air bubbles, and also improper pouring of the impression can cause air bubbles. The articulator is a device that holds the maxillary and mandibular models in occlusal relationship. I'll have to get a model for y'all to be able to see. So basically, it's when you have both of the models already together, there's going to be a metal piece that it's going to set into, which I will show y'all as you come in, and I've got them in some of the rooms here. So just know that the articulator is what holds the maxillary and mandibular models in occlusal relationship. Our model trimmer, remember whenever we were doing it, of course I had one that was spitting out way too much water, so we didn't end up using that one, but the other one, we need to make sure that we have water going that whole time, okay? And then we never pour the stone down the drain because it's going to harden in there like concrete. Creating a light cured custom tray. Before constructing this type of tray, paint on a separate medium on the model, trim away excess materials with your lab knife. Those are just some instructions that you'll need to know. Safety precautions in the lab. Always PPE must be worn when working. Always follow your manufacturer's instructions. No eating or drinking in the lab or any working areas. Make sure that they are kept clean. But you know, it can get pretty messy working in the lab. So I look forward to having you guys come in and work on some more checkoffs. So I will see y'all tomorrow and Thursday, and then next week we will do Monday, Tuesday, and Wednesday to try to get all these checkoffs done. If you need anything from me, just send me a message. Thanks.